Para empezar, me gustaría dar la bienvenida entonces a todas y todos que están aquí participando del webinar de la Sociedad Regional DOHaD Latinoamericana. Es un placer tenerlos todos aquí. Estamos empezando nuestras actividades de 2025, que es un año realmente que vamos a tener la ciencia en el ámbito del DOHaD en destaque, ya que tenemos el Congreso Mundial ocurriendo en Buenos Aires en exactamente 4 meses, de 7 a 10 de septiembre, y están probablemente todos ya enterados que se terminaron el envío de resúmenes la semana pasada y tuvimos casi 500 abstracts enviados. Entonces estamos muy felices, muy agradecidos y ahora trabajando entonces en la evaluación de estos resúmenes para que luego se puedan tener el resultado de las evaluaciones con los resúmenes aceptos para póster, para presentaciones orales y también los Travel Awards. Para quien no tuvo la oportunidad de enviar el resumen en este momento, tenemos un late break submission para abstracts y las fechas todavía no están definidas, pero así que la tengamos, probablemente va a ser en junio o julio. Sí tendremos un segundo momento, entonces, para los que no pudieron enviar sus resúmenes en este momento. Me gustaría, entonces, aparte de dar la bienvenida a todos, a estas primeras informaciones, hacer ahora la divulgación, como prometido, de la medalla David Barker a nuestra miembro de la Sociedad Regional DOHaD Latinoamericana, doctora Elena Zambrano, que está aquí con nosotros hoy y mucho nos honra con su presencia aquí para la divulgación de este premio, que es realmente un logro enorme para Elena, obviamente, para todo su grupo, para México y para América Latina como tal. Sabemos de la historia de Elena aquí en México, de todo el pionerismo que tiene en el trabajo de DOHaD, y creo que esto de cierta forma corona el trabajo, no solamente de Elena, pero de DOHaD en México, en América Latina, en nuestro Congreso Mundial, y nos da un sentido mucho más afectivo y amoroso para este congreso que estamos organizando con tanto, tanto, tanto trabajo y tanto amor. Y Elena se está dedicando también mucho a la organización de este congreso en el comité científico. Entonces, realmente es muy emocionante presentar a Elena como la ganadora del premio. Entonces, la Sociedad Regional DOHaD Latinoamericana celebra con mucho orgullo la concesión de la medalla David Barker a la doctora Elena Zambrano, pionera en la investigación DOHaD en México. La doctora Zambrano ha supervisionado a 25 estudiantes de licenciatura, 9 de maestría, 8 de doctorado, 4 de pós-doutorado, con más de 160 artículos publicados en prestigiosas revistas científicas internacionales. Su legado refleja el impacto significativo de las contribuciones de su equipo a todo el campo DOHaD. Jugó un papel fundamental en la creación del capítulo iberoamericano de DOHaD. O sea, estamos aquí en gran parte porque Elena mucho trabajó para la fundación de esta sociedad y desempeñó como vicepresidenta de la Sociedad Regional DOHaD Latinoamericana en 2017 a 2020. Durante este periodo, su liderazgo fue clave para ampliar el conocimiento y la colaboración en torno del concepto DOHaD en toda la región latinoamericana. La doctora Zambrano es una figura respetada y un modelo a seguir en la comunidad DOHaD latinoamericana. Su fortaleza, dedicación y excelencia científica han inspirado no solo a sus estudiantes, sino también a innumerables mujeres científicas como yo, que ya sabe, Elena, que soy su fan number one. Especialmente por su defensa de la igualdad de género en la ciencia. Su investigación se centra en la nutrición materna, obesidad, envejecimiento, dimorfismo sexual en la programación metabólica y el desarrollo de la descendencia. Estudia ventanas críticas del desarrollo desde la preconcepción hasta la lactancia y el envejecimiento, o sea, abarca todos los tipos de vida, con un enfoque especial en la placenta, la línea paterna y la lactancia. La Sociedad Regional DOHaD Latinoamericana invita a toda la comunidad DOHaD a unirse en la celebración de este prestigioso reconocimiento hoy a las destacadas contribuciones de la doctora Elena Zambrano. Parabéns, Elena. Estamos muy, muy, muy orgullosos de ti.
Obrigada. Gracias, thank you. Ay, Cris, un poco exagerada, Cris, pero muchísimas gracias. Obrigada, thank you. La verdad es que Creo que estoy obviamente sorprendida, muy contenta, pero este es un trabajo comunitario. A mí me toca representar el trabajo de, pues, muchas mujeres, latinoamericanos, hombres y mujeres de la región que hemos trabajado muy arduamente y pues bueno, me toca poner la cara de un premio que merecemos todos. Y pues muchas gracias, ya celebraremos en Buenos Aires.
Maravilloso, maravilloso. Muchas gracias, Helena. Es un placer poder convivir y aprender contigo todos los días. Yo en este momento estoy aquí haciendo mi estancia de 6 meses en el laboratorio de Helena, aprendiendo muchísimo todos los días y realmente muy emocionada por poder presentarla a este premio juntamente con Gloria, representando entonces la indicación de la Sociedad Regional DOHaD Latinoamericana. Y sí, lo logramos y Helena entonces es la ganadora de la medalla David Barker y va a presentar en el punto alto del Congreso Mundial en Buenos Aires. Y ya se está preparando para eso, que ya tengo información aquí. Bueno, muy bien, muy felices por eso. También, obviamente, me gustaría saludar y felicitar a la doctora Kristen Connor, que recibe el premio Nick Hales en esta misma oportunidad. Entonces vamos a tener en Buenos Aires, aparte de toda la programación del Congreso, que ya la tienen informada en sus correos electrónicos. Si todavía no están recibiendo los correos, pueden enviar un correo al correo de la sociedad o a nuestras redes sociales y agregamos entonces su correo a la lista de contactos de nuestra sociedad y así van a tener toda la información siempre en primera mano. Bueno, ahora entonces me gustaría hacer la presentación de nuestra ponente que abre los webinars de 2025 de la Sociedad DOHaD Latinoamericana. Fabiola Isabel Suano de Souza. La doctora Fabiola, bueno, voy a presentar en inglés a partir de ahora entonces. Dr. Fabiola Suano holds a medical degree and complemented the head residence in pediatrics at the Faculdade de Medicina do ABC in São Paulo, Brazil. She earned her master's degree and PhD from the Escola Paulista de Medicina, Federal University of São Paulo, UNIFESP. She obtained the title of specialist in pediatrics in 2003 with subspecialty certification in Paediatric Nutrition and in Parenteral and Enteral nutritional therapy from the Brazilian Society of Paediatrics. Dr. Fabiola Suano is currently an adjunct professor in the discipline of General and Community Pediatrics in the Department of Pediatrics at UNIFESP and an associate professor in the discipline of Clinical Pediatrics at the Department of Pediatrics at Faculdade de Medicina do ABC. She is a supervisor in the Postgraduate program in Pediatrics and Applied Pediatric Science at UNIFESP also. She has participated in working groups of the Brazilian Ministry of Health on the feeding guide for children under 2 years old and childhood obesity. Currently, Dr. Suano is Research and Scientific Excellence Coordinator of the Latin America DOHaD Regional Society and serves as President of the Department of Paediatric Nutrition at the Brazilian Society of Paediatrics. Fabiola, muito bem-vinda ao nosso webinário. Fabiola faz parte do nosso comitê executivo da Sociedade Regional DOHaD Latino-Americana e é um prazer te ter aqui hoje, então, para abrir os nossos webinários de 2025.
Hello, everybody. Boa tarde a todos. Buenas tardes. I am very, very happy to stay with you here. I have some problems with Spanish to talk, but I totally understand. So I talk with Chris that to talk in English, but the questions, the answers, we can do in English and Portuguese, and Chris help me in Spanish too. So I'm very happy to stay here. Congratulations, Professor Helena Zambrano. It's a pleasure to stay with you here and listen. Last year, Professor Helena talked with in our Chris, the discipline of pediatrics with Paola and Erica. The students loved you, and it will be a pleasure to see you in person in Buenos Aires. Congratulations! This medal you you deserve for everybody, and I'm sure you inspired a lot of women, research women in Latin America and around the world. Congratulations, my pleasure to talk with you and audience. Thank you so much to invite me, Chris, and Latin America DOHaD to talk in this opportunity. Let's go. We will start to talk about the promotion of preterm infant health in the double burden of malnutrition. Is like a big history, and of course I use some parts of my research, and I will share with you some things about the Brazilian history in health. So the first part here I would like to share is that I am a pediatrician. I am doing research in pediatric nutrition. It's a very important part of my life because it's not possible separate the clinical of the research in my idea in this topic. So I needed to have a lot of connections with the people around the world and in Brazil, like Chris, like Marli Cardoso, epidemiologists. So I think my ideas, or my better ideas, emerge in my clinical experience. So as a part of that, I would like to share with you in this presentation. So during this presentation, I will talk to you in 4 parts. My presentation I divided. I will explain something about the double burden of malnutrition, especially in pregnant women here in Brazil. I will share some information about prematurity, the problems in short and long-term health. And I know here we have a Professor Albertina. She's a neonatologist too, so thank you so much. I expected to explain some parts of the neonatology problems here for us. And I will share some information about my clinical research, especially about the DOHaD perspective, and take message to home, not just for you, but for me too, because here it's possible I will have some ideas for new research. So about Brazil, I'd like to share. I don't know if everybody here stayed once in Brazil, but we have a continent. It's not just a country, it's a continent. A huge territory with a huge population. About the maternal and child health indicators, these indicators are very different depending the part of the country we are seeing. So the median is that the fertility rate is around 1.8 per woman, the child mortality rate around 12.4 for 1,000 live births, and the neonatal mortality is the first cause of the mortality rates in child. What is very important is that each year we have around 3 million newborns in our country, and around 11% of these newborns are preterm. So the percentage of preterm birth is similar of the other countries, but our population it's so high, so the numbers of preterm infants around our country is so high too. And this is very important because it's a health problem, or we need to have a specific word about the situation in different parts of our country. Of course, we have a lot of problems, but I'm sure that our country it's very nice, but we have a lot of problems, especially the inequality and poverty. But if I can see, or I can talk something about my country, is that we're not poor. We have inequality. Inequality is the big problem in our country. So we have a lot of opportunities too, because we have a public and universal health system, so young when you compare with NHS, for example, but we have a huge public and universal health system. Sistema Único de Saúde, or SUS, is a little name that we would like to talk. In this system, in this public and universal health system, we have a lot of health programs for women and children. Especially, my country, Brazil, is knowledge about the breastfeeding policies, human milk banks. We have a huge number of human milk banks. We did the implantation of baby-friendly hospital initiatives so early, and in this scenario that I would like to talk about the perinatal health. Here is some guidelines or material that we have used in our hospitals, in our perinatal take care. Especially, it's very important the use of kangaroo method, the human milk banks, and a lot of others public health that is universal in our country. We have two passport of children. Is a passport that each children in our country receive when they born. And recently, we have an excellent initiative of the health minister is transformation in the passport of the children in app connected with the health system. So in the next years, probably we can assess the health of our children, the history of the health of our children, the mother and the doctor, directly in this app. So it's a very important initiative of our country. I think it's a very, very important, not just for the research, but especially to do the adequate follow-up of all children around our world. So now I would like to start about the impossibility to disconnect the intrauterine health or mother health of the postnatal health, especially during the first month of the life of the baby. So it's impossible to disconnect. So in the LA-DOHaD concept, it's so clear a lot of years ago. So today, and I think in the future, this topic will be more and more important, because when the women are pregnant, the metabolic and feeding adjustment during the pregnancy, it's so important. It's not just because the baby is in intrauterine growth, but the adipose tissue of the mother change, the pancreas, the cardiovascular circulatory system change, and the brain change too. Recently, we have a lot of studies that introducing the concept that the brain of the mother change during the first years of the birth. So this is very important because there is a special connection with the baby and the mother after the birth too. And of course, the breast change totally, because it is a very important connection with mother and baby regarding or related to breastfeeding. Recently, I have a publication with Professor Ozani group talking about some ideas. As you know, Professor Ozani, it's a basic research. So I'm talking with her that is very important to see the child to the children. So the idea is to understand better the epigenetic mechanisms, not in short, not just in placenta, but in the childhood too, especially in the aspects of the infant health related with the mother diet and the baby diet. And when we are thinking about the baby diet, we are thinking especially about the breastfeeding too. So I invite you to read this paper. It's a very nice paper. It's easy to read, and the pictures are very nice. Now I would like to talk something about the double burden of malnutrition. What do we have here in Brazil? We have a connection with different problems about nutrition. We have undernutrition in the pregnant women. We have overweight. More than 1/2 of the mothers in Brazil, the pregnant women, are overweight. But we have two vitamins and iron deficiency. So micronutrients deficiency happens here connect with overweight. So here we have different types of nutrition problems in pregnant women. So we know that the nutritional problems are related or increase the risk of diabetes, of hypertension in pregnant women. So we increase, or we can increase, the rate of preterm birth. The principal causes of preterm birth here in Brazil are related with preeclampsia, genitourinary tract infections, malnutrition, and gestational diabetes. Here we have a very interesting point that we have a high number of normal body mass index women, young women with severe preeclampsia, and with a high number of babies, preterm babies. So I think the type of diet, it's very important in this connection, especially because we know that preeclampsia is related with inflammation, and we have obesity. We can have obesity with inflammation, but we have bad diet habits, bad intake food related with inflammation too. In this picture, we can see that Brazil has a huge number of preterm birth. We estimated here that around 1,000 preterm birth per day happens here in Brazil. And we have a high percentage of the babies with small gestational age. So we have a high number of preterm births, and around 30% of these babies suffer with intrauterine restriction growth. What is very important when you think about the DOHaD context, the follow-up, the growth after the birth, and the repercussions of the health, cardiovascular disease, and neurodevelopmental situations of these babies. In Brazil, we have a very important neonatology work. The neonatologists in Brazil work together among the doctors and connect with the other countries too. So we have a high level of assistance in different parts of our country regarding the neonatology assistance. Because of that, we had during the last decades a important reduction of mortality. So we have a high number or high percentage of morbidities too, especially when we are seeing the neurodevelopmental disorders, malnutrition, especially in the first months after discharge, and chronic pulmonary disease and retinopathy of prematurity. So we need to understand better how we can work to improve the neurodevelopmental of these babies and reduce the risk, for example, of chronic diseases like obesity or hypertension during all the life. And in these pictures, we can see, as you know here, everybody here studied this a lot of time, more than me. But I would like to share with you this picture here. And can imagine in this picture, when you think about the plasticity, how is different the preterm birth when you think about the plasticity. The babies are younger, the systems are immature, and of course, the plasticity is so high, or is higher when you compare with the term baby. It's very nice because when you can input some good stimulus in the early life, like breastfeeding, for example, and the kangaroo method, for example, you can reduce the risk of chronic disease along the life. But it's for the babies survive, it's necessary to put a lot of injuries during the first months of the life. Oxygen, antibiotics, noises, pain. So it's it's not possible to separate the situation or divide the situation when you think about the preterm birth. So it's impossible to see these babies such as a group with high risk of the problems around all life. And it's a very important aspect to follow up of the pediatricians around the world. About this follow-up or the specific take care with the babies, I would like to discuss with you 4 important points. The first is the postnatal growth. What is malnutrition, or what is no recovery or no catch-up? The importance of the breastfeeding. There is a challenge to maintain the breastfeeding in preterm babes. Some news information that we have about the complementary feeding, the introduction of solid foods, and how it's important to understand or to identify the early markers of cardiovascular risk in this population. This is my scenario of research. Here in these 3 scenarios, we have a hospital, a maternity that we have a high number of the babies that birth every day, and we have a prenatal mothers or pregnant women with disease and normal pregnant women. Here, the other scenario we have that the ambulatory that we are doing the follow-up of these babies, and the third is like a scenario, clinical scenario, but we have a connection with the clinical and the basic research to development the strategies to identify different factors in blood or in human milk or in placenta and connect with clinical aspects. Here we have, in these scenarios, we have a cross-section and cohort studies, evaluation pregnant women with obesity, gestational diabetes, hypertension, their newborns, preterm low birth weight and small for gestational age babes. And it's important because in this scenario we can compare with the normal babies or babies that born in term. And we have the follow-up this around 10 years or 15 years, because this research started when I was a resident or start my career. And the principal outcomes that we are seeing in these babies is obesity and some risks, some cardiovascular risk that today we can identify in better situation. And for this, it's very important because my group is learning, is studied a lot with basic research. We have a very strong connection with the basic research because the insights of the ideas of mechanisms we have with the basic research. And when we understand better the mechanism, we can try to understand these aspects in clinical data. Just as this is a picture that to show you, here we have Brazil, here is São Paulo, I am here now, and this is like a line in the place that I've worked every day. I'm not walking, I use my car or public transportation, but the places are near, so it's easy to work in the same situation. Here, I would like to share some pictures about the scenarios that we are using to research, but of course we use for the clinical attention too. Is a couple with the newborn, the skin contact in the first hour. They use or to put the baby for the breastfed in the first hour. Here is ambulatory to support the breastfeeding. Here it's very important because in this picture we can see a obese woman, and the breastfeeding in obese woman is not so easy. We have a lot of factors involved in these aspects, so it's very important to have strategies or different ways to improve this possibility to maintain breastfeeding. During the COVID pandemic, to COVID, we promote breastfeeding too. Was not a good, was not easy to maintain our protocols during the COVID pandemic. So we maintain the breastfeeding, the contact, the mothers inside the maternity. And of course, here are some babies. We have here some babies breastfed. The twins, the baby in ambulatory, in two situations here. So I think it's a very important point to understand now our outcomes, or the outcomes we are searching. We need to understand better. So the first topic I would like to share is postnatal growth. About the postnatal growth, the first topic that I would like to share with you is not possible to compare the intrauterine growth with extrauterine growth in preterm babies. The first answer about that is, if the baby born preterm, the baby will be growth different. How much, how intense, the problems that we can see depends the situation, but the growth will be different. The intergrowth group or the intergrowth curves were very important to describe for us how different is the growth of these babies that born preterm when you compare with the growth inside the uterus. In our data, we have a cohort with around 1,000 babies. And here I introduce you, or I show you the follow-up until 12 months to compare or to see the evaluation of the weight, length, and head circumference. What is important is that at discharge, a high percentage of these babies are or suffer with malnutrition. They have a stunting and wasting, especially for weight. The weight is so bad when you compare with the growth curves inclusive. Weight, length, and the head. So with 12 months after, it's clear that that was a recovery. The baby's recovery. We have a very interesting line, not just for weight, but the length to recovery and to 12 months, especially when we think here about the weight, about the length. And the head circumference is the first parameter that starts to recover. What is very, very important? It's very important because the brain has less time to recover during the infancy. And for preterm babies, the best target of the good evaluation is neurodevelopmental. And when we can see here at 12 months old, we have a small percentage of the baby suffering with wasting, so the recovery is not bad, but we have a high percentage of the baby is stunted. So we have the babies is still more time suffering with the short stature, the problems with the length. And for the other side, we have I think early problem that 6% of these babies suffer with obesity. Now we can remember that the babies 1 year ago receive or go to the home with malnutrition, wasting. 12 months after, they are suffering with obesity. So the recovery is so high, so intense, and we know how this can be a problem for the neurodevelopmental, the developmental of chronic disease, especially cardiovascular disease. The second point that I would like to share is about breastfeeding. We know that today we have a lot of publications about that, and I see that in Buenos Aires we will have a professor Escamilla too, that he is a very important person that is a promotion of breastfeeding around the world, not just in the United States or Mexico, but around the world. We know that the human milk today is a biological system. And when we are studying human milk, we need to understand something very important, that the human milk is not a food. Human milk is like a tissue. So there is a lot of components of human milk that you don't understand very well, that promote the connection of the baby, of the mother, and in specific aspects is like translate the health of the mother for the baby, and promote a lot of good outcomes in long-term aspects. So in the Professor Victor, of the head of the Pelotas cohort in Brazil, in this publication, he showed for us that the breast milk prevent some diseases that are very important for us in the developed world. For example, children that receive breastfeeding during the infants reduce the risk of obesity, type 2 diabetes, asthma, inflammatory bowel disease. So here it's clear that we have some components in breastfeeding, probably epigenetic components that we need to understand better, that promote the health in long-term aspects. In this paper, it's clear, and it's so beautiful in my opinion, that it's clear that the human milk composition is totally different, depending the mother to mother, the health mother, the phase of the lactation, the weight of the baby. And we have carbohydrates, fats, proteins, bacteria. But now we know that we have some aspects, for example, the nucleotides, DNA fragments, non-coding RNAs, that the breast, the mother offers for the baby ingests the milk, and probably we need to understand better the mechanism. The transference of the epigenetic factors can influence the genetic expression of the babies in short and long-term aspects. And now I would like to share some information about the human milk for preterm babies. That in Brazil, we have, of course, a lot of human milk banks, and the mother can do the donation of the human milk for the human milk banks. These banks test the human milk banks, do the evaluation of not the quality, but the security of this human milk, pasteurize this product. I think it's not correct word product, but of this food. And it's possible to offer for the babies, the other babies that will be, or that are hospitalized during the duration of hospitalization, this human milk to these babies, because we have a lot of the good outcomes when the babies receive exclusively human milk during the hospitalization. For example, when you compare the babies that receive human milk during the hospitalization with the babies that receive infant formula during the hospitalization, we have a reduction of the risk, or the case, or the frequency and incidence of necrotizing enterocolitis and neonatal sepsis. So it's very important, because both are causes of the mortality in preterm babies. So when we can offer the own mother's milk, the mother express your milk and this milk is offered directly for the baby, the outcomes of these babies, it's more important. For example, the babies that receive it during the hospitalization on mother's milk, or the more percentage of on mother's milk, has along the life better neurodevelopment, better bone health, reduce the chronic lung disease during the hospitalization. They have lower risk of obesity, dyslipidemia, and less values of blood pressure. So, of course, here we have a situation that the pasteurization, for example, if you have the human milk of the other mother, and if this milk suffer the pasteurization, the composition is different, or is totally different, or there are some modifications, and the outcomes are different too. Here I share with you is the place that we receive the donation. We test this human milk, and after that the human milk suffer the pasteurization. We can do, or we can evaluate the quantity of the fat, the protein, and carbohydrates in the samples of human milk. It's interesting because there is no a big difference with pasteurization regarding the macronutrients in human milk. And in some samples, we can evaluate the other components. So in our research, now we started to understand the other components in human milk that can influence the outcomes that is different when you compare pasteurized and all milk for the babies. One of that is about the breast milk microRNAs. Mammary epithelial cells secrete a lot of high content of microRNAs. Is like a cellular communication between mother and infant. Today we can identify some important microRNAs that are involved in some outcomes of preterm baby. What is more important is that the pattern of microRNAs in human milk of preterm mothers is different when you compare with term mothers, is different when we compare with the first days of the human milk, that the colostrum. So it's like a individualized situation when you have a different types of microRNAs, depends if the baby born preterm and term. What is more interesting when you compare, when you understand better which one are these microRNAs, in this study especially, they identify that 9 different microRNAs more important when you compare the human milk of the preterm babies with term babies, and these 9 microRNAs are involved or can influence 4 target genes related with growth, adiposity, and immune response. The 3 aspects very important in the development of preterm babies. And the pasteurization can reduce significantly the number or the quantity of microRNAs in human milk. So here we have a pilot data, unpublished data, that we can see that before the pasteurization, we have a higher quantity of microRNAs in human milk. And after the pasteurization, this quantity reduced very in the very important way. What or how, which one, we don't know until now, because in the next step we will do the sequence of this F microRNAs in human milk, breast and human milk, to understand better about that. But I think this is a very important line of research to improve human milk banks are very important, very important. We can discuss after my presentation about that, but we need to improve the use of the own human milk, own mother's milk for the baby directly, especially when I think about the preterm birth. The other point I would like to share with you is about the complementary feed. The complementary feed is a time when the baby starts to intake solid foods. When I think about the preterm birth, the suggestion is the preterm birth should start to receive solid foods when they complete or they have 4 weeks of correct age. We need to do this adjusted. Consider the neurodevelopmental, and sometimes is like or similar 5 kilograms. But the most important point is using the correct age in the neurodevelopment. Here in Brazil, we have, I don't know in the other countries, but here in Brazil, we have a big problem that in general, in infants in general, we have a high percentage of these babies, 7 to 8%, receiving regularly ultra-processed foods in the diet. Cookies, soda, for example, products with sugar, and here we have a lot of examples of that. It's very bad, but it's the frequency of the babies receiving this type of product is so high in our country in young children. And we know that the intake of the ultra-processed food is so bad and increase the risk of diseases like cardiovascular disease, mental disease, respiratory disease. We can imagine how this could be bad when you think that can happen with preterm birth and with the different types of plasticity. There's not just the quantity. The problem is not just the quantity of sugar, fat in the ultra-processed food, but during the processing of this type of food, there is the dry heating production of processed food. We have a mild reaction, and we can appear the AGS. Like here we can see, AGS has receptors in a lot of organs and system, and they can activate a sequence related or regarding, or that the result is oxidative stress and inflammation. That is one line of the increase of cardiovascular disease. So the population, the babies, has ingestion of this type of food, and they can increase the inflammation and oxidative stress, and is a big problem when you think about the cardiovascular risk. In this publication, we can see this when you compare the preterm and term infants at 12 months old, and we compare the energy intake of ultra-processed food. In the preterm group, the percentage was 39, around 40% of the energy during the day in these babies is result of ingestion of ultra-processed food. And there was a direct relation here in this graphic between the energy of ultra-processed food with the serum levels of C-reactive protein, a simple marker of inflammation. But in young babies, especially in preterm babies, this association is so important. It's a very important topic. It's important to promote the breastfeeding, but it's very important to promote the habits, adequate habits, food habits in young children in general, but especially in preterm birth. And when we compare for example, some markers of cardiovascular diseases like lipid profile or serum levels of myeloperoxidase, for example, we can see here that in preterm group, the serum levels of myeloperoxidase are higher when you compare with the term group, in the same age. So we can see that this group has a high percentage of nutritional problems, and they have more frequent or higher levels of the early markers of cardiovascular disease. For the take-home message, I would like to finish here talking that preterm birth is an important condition. It's an important condition to understand there is an impact of the quality of life of the baby, of the family. We need to understand that we have a public policies to promote the health of the babies. We know that they are increase in the risk of non-communicable chronic diseases. The best, of course, is prevent to preterm birth, but we know that today we have a lot of problems in the women pre-pregnancy. So of course we have a high number of the problems during the pregnancy, and the risk of preterm birth can increase. In the DOHaD perspective, we can modify the trajectory of risk. I think this is my important point here to talk or to share with you. In the DOHaD perspective, we can understand that we can modify some aspects of these risks. Promoted balanced growth, but we need to understand which is balanced, not too much and not too fast. We should stimulate the breastfeeding, it's very important, and the health complementary feeding, and the good life, good habits around all life. And we needed to pay attention in primary care to identify the early markers of cardiovascular risk. It's for everyone, of course, but for this group that's so frequent, we need to understand if these early markers of cardiovascular risk are important. If they are important, what we need to change, what we can do to improve the better health for this group. And this is everyone's commitment to this and future generation that we are doing here in the DOHaD perspective. Here is an example of one of these babies. This baby is Bernardo. The name was the name and the pictures were authorized for the family. He born with 0.7 kilograms, so small, this baby. Here is Bernardo during the outpatient follow-up after discharge. Continue with the breastfeeding. You can see here that the baby is so small in this situation. Bernardo around 12 months, 9-12 months here. And finally, Bernardo here in our evaluation, and the pediatrician is not me here, but a colleague, measured the blood pressure during the follow-up of pediatrician. What is very, very important is not for Bernardo or preterm for everyone, but in this situation, this is very important. I would like to share here and so to say thank you for my group, the research that are shared these ideas with me. We have here basic research, clinical research, dietitian, doctors, pediatrics, a lot of neonatologists, of course, our postgraduate students, the undergraduate students, especially medical undergraduate students that share with us, especially during this phase when we can amplify our connections around the world and our research to share not just knowledge, but friendship too, that we think it's very important in this world. Which is more important, which are more important are people. And finally, I don't know if everybody knows, but is a picture of Tarsila do Amaral. Tarsila do Amaral was a very important, very talented woman in our country. She's a painter. This painter, the name is A Família, the family. And I think it is the idea about what is health is exactly like that. We have a family, different ages, we have a animal, we have breastfeeding, we have a toy, we have a fruit. This is what is very important to promote the health, not for the baby here, but for everybody. It's a very important to connections. These connections is a very important. And finally, I love this phrase of Louise Glück. Louise Glück, winner of the Nobel Prize in Literature in 2020, the other important woman. And I am a pediatrician, so I needed to promote pediatric ideas. We see the world only once in childhood. The rest is memory. So invite you to remember something important for you. And I am sure that a big part of these memories were in childhood. Thank you so much for your attention. I'm totally open to share ideas.
Excelente, parabéns. Fabiola, sempre tu nos dá mais do que uma palestra, uma aula, realmente, uma aula de humanidade, de nutrição. É impressionante. Muito, muito, muito obrigada. Vamos abrir para questões. Podem fazer perguntas em espanhol, em inglês, em português. Sintam-se à
In
vontade.
francês, French too, because Chris is very nice in French.
Essa é uma piada interna.
Eu gostaria de fazer uma pergunta,
Por favor, fica à
por favor.
vontade, Fer.
Inicialmente, Fabíola, parabéns. Parabéns. Sinceramente, eu estou emocionada. Que palestra, que lição, que maravilha o seu trabalho. Isso, assim, desculpa, eu gostaria de falar isso em português, porque é natural, óbvio, né? Em inglês ou em espanhol não seria natural. Mas eu estou encantada e, assim, maravilhoso o trabalho, maravilhosa a mensagem, tudo. Parabéns por tudo que você faz por essas crianças, viu? Eu tenho uma pergunta a respeito. Você comentou que a composição do leite materno é variável conforme o peso do bebê. Eu não entendi muito bem. Você poderia explicar como que isso seria possível, por favor?
Obrigada, Fernanda, pela pergunta. Eu vou fazer em inglês e aí a gente completa se precisar alguma questão. When I talk, thank you so much for your comments. Is like because I like it too much to work with these babies, and it's not the babies, it's the family. The family, I think, is the most important. I have a lot of experience and share experience about the histories of the small babies here. The idea about, Fernanda, peso, when I talk about the peso, I'm talking about the gestational age. The baby are small and the gestational age is early. It's more gestational age than birth. But I will share, for example, one idea. Is different too when you think the human milk composition, when you compare not just for protein, carbohydrates, and lipids, it's other components that we need to understand better, but it's different when you compare the baby small for gestational baby, that the baby suffer with intrauterine growth restriction. The composition of human milk can be different when you compare with the baby just preterm or
Mhm.
the baby with the same gestational age and the different weight. Where we will understand it's important, the hormones in the woman, because the placenta has lactogênio placentário, and lactogênio placentário can influence the production of breast milk. And the second point is the maturity of the gland, mammary gland, because the cycle of the mammary gland is like animals too. During the pregnancy, in the maturity of the mammary gland finish to start the production of the milk around the 4th weeks. When the baby born before, the breast is not totally mature and the composition can be different. So
Different.
the idea is like that. It's not just for simple components, but more complex components.
Okay. Very interesting. Thank you very much.
Cuando pueda,
I don't know. I have Alejandro, sorry. I just like
no.
to do a question for my colleagues here of the basic research about the breastfeeding in animals in general. And it's possible to identify different compositions and different aspects of the mammary gland maturation during different phases of the pregnancy. It's possible to identify, it's possible to compare with mammary glands of human. I don't know.
Well, in fact, with the rodent model, I do not have this question, but I also work with the pig model. And in the pig model, what we see is that we do not have, in fact, a difference in composition. However, we have a difference in production. So we have an increased production around 3 days after farrowing. Sorry, 3 weeks, 3 weeks after farrowing. So we have the highest peak of milk production then. And afterwards, the milk production comes down.
Okay, thank you.
Thank you.
Bueno, no sé si... Bueno, soberbia la presentación. Yo creo que tiene un valor que ella habla de lo que piensa cotidianamente en su práctica clínica y lo lleva mucho más allá. Entonces, yo creo que muchos podemos buscar bibliografía y hacer una buena presentación, pero cuando uno, aparte de la excelente búsqueda, del excelente trabajo, se nota que hay un pensamiento de tanto tiempo, aunque sea joven, lo cual es maravilloso. Yo quería simplemente hacer algún comentario quería, por lo que vos dijiste recién, también decir que la composición de la leche humana varía de madre a madre, no solamente en cada momento, no solamente en cada tiempo, sino de madre a madre. Y esa composición, tanto en macro y micronutrientes como en las bacterias que tiene la leche humana, tienen que ver con el medio de donde viene esa madre y el medio donde ese hijo va a ir. Entonces, la protección es una nutrición individualizada, específica para cada hijo. Por eso también, si bien la leche de banco es muy importante cuando la leche de la propia madre no está disponible, nuestro trabajo tiene que ser lograr que la madre se alimente con leche humana y que egrese de las unidades de neonatología con alimentación con leche humana específica. Eso era un comentario que me parece que no está. A lo largo de tu presentación surge eso también. Yo lo que te quería preguntar es, vos hablaste de crecimiento, yo creo que también ahí hay que pensar en la individualización del análisis del crecimiento, pero sí, el tema de la composición corporal de nuestros pacientes prematuros, según con qué los alimentemos, y si nos podías hacer, yo creo que crecimiento no es peso, sino que va mucho más allá, y que eso también tiene que ver, los que pensamos en términos de curso de vida e impacto cómo podemos evaluar, o si debemos evaluar, o si tenemos que empezar a buscar la forma de evaluar en la práctica clínica, la composición corporal. Y bueno, esa es una pregunta, después hay otras, pero voy a dejar a otra gente, pero esa es una que yo te quería hacer.
Obrigada, Alejandro. Uma honra. I'm honored to see you here in my presentation. So I'm very happy today. It's a very special day for me, believe me. I believe that the body composition is very, very important to understand the outcomes for the babies in long-term aspects. I think it's very, very important because we know that when the baby has increased the weight, for example, we don't know if it's a muscle, if it's a fat, if it's a bone, brain, we don't know. But we have a challenge. We don't have, I don't know here, probably, I don't know if you use something. We don't know until now that I am studying excellent method to evaluate it in clinical practice, the body composition of the babies. We use sometimes circumference, thickness, but in clinical practice, sometimes it's not possible to identify exactly the quantity. It's different of the adult, exactly quantity or better quantity of fat or muscles of the body composition in clinical practice. But we have some equipment about that. The PPOD, Paula wrote now here, the PPOD, that it's possible to measure the body composition of the babies is, I don't know if somebody see, is like a scan, a big equipment. It's not so big, but it's like a Superman capsule. How did you watch the first movie of Superman, that the Superman arrived in the Earth in something like an egg, is like a peapod. Peapod is a very nice equipment to measure the body composition, but it's very nice to research, and the price is so high for we have frequently. So I know that the intergrowth studies with Professor Villar, Professor Albertina here, they have some papers recently published that they used the PPOD to evaluate body composition of the babies, and the outcomes is totally different when you compare just for the weight. So I love your question because I think we can understand better the interventions when we have better outcomes to understand. So for clinical data, day by day, we don't have good instruments. For research, the PPOD is a very nice option.
El grupo Villar está implementando, hay unidades de Brasil, hay unidades de Argentina, impedanciometría, tratando de validar impedanciometría como un método para evaluar en la práctica clínica. Esperemos que se publique pronto.
Very nice, because the impedanciometry can be easy to do that. Not just for when I talk about the PPOD, is because here, for example, in Brazil, I think we have just 3 or 4 PPODs in Brazil. The number is not so big. We need to have a better, easier measurement of composition.
Excellent. Paola?
I just wanted to add to the comment of Fabiola regarding the body composition and Alejandro's comment on the bioimpedance method. With the preterm babies, this is very complicated because, you know, bioimpedanciometry is very dependent on the water in the body, and preterms are very, how do you say, vulnerable regarding volumes. So it's going to be with newborns, term newborns, this could be an option, but with the preterms, it's going to be a problem. Probably all the systems that we know have a problem with the preterms because the preterms many times are connected to mechanical ventilation, etc., etc. So you need to do precise measurements. One of the problems that you get to follow up the growth not only is the composition but the size because the baby is flected. I'm not sure Valeria didn't connect, but Valeria is doing a grant to try to do some. You met her, Fabiola. You met Valeria de Toro when you came here. She's doing some study with the designers to see how to measure how the preterm babies are growing in length, and she's doing some imaging options. So I think this can be an opportunity also to do some innovations in medicine to measure body composition, growth, adiposity, etc. Yeah.
Muy interesante.
Exactly. Exactly.
Sí, las dificultades. Pero quizás el tema es encontrar en qué momento de la vida de un prematuro puede ser factible y valioso medir la composición corporal. Probablemente en un momento de adaptación del agua y los líquidos no, pero a lo mejor cuando llega el término, las 40 semanas, quizás ese sería un buen momento para probar distintas formas de evaluar. Pues sabemos que la característica del prematuro cuando llega al término tiene muchísima correlación y el tipo y la calidad de crecimiento con lo que le va a pasar en la vida. Pero muy interesante tu comentario, Pau.
Excelente. ¿Alguien más tiene alguna cuestión? Estamos ya un poquito pasados del tiempo que en general nos proponemos. ¿Nadie más? Bueno, entonces me gustaría finalizar agradeciendo mucho la participación de todos y en especial a la doctora Fabiola Suano, que nos brinda con una más de sus excelentes clases, presentaciones. Realmente nos deja muy feliz. Está aquí empezando los webinarios de 2025, representando a la sociedad, al Comité Ejecutivo de la Sociedad Regional DOHaD Latinoamericano. Ahora, en un mes, tenemos la presentación de la doctora María Luisa, que también está representando el comité, en este caso, asesor de la Sociedad de DOHaD Latinoamericana, y están invitados para que propongan nombres para presentar en julio. Tenemos un spot libre en julio para presentaciones, en agosto también ya estamos comprometidos y después, bueno, cerramos el año entonces en Buenos Aires, todos reunidos en exactamente 4 meses para el Congreso Mundial DOHaD. Muchas gracias entonces por la presentación de todos. Fabiola,
¿Una foto?
muy obrigada. Diga, Ale, por favor.
¿Una foto?
La
Como así.
foto.
Ah, sí, podemos tomar una foto de
Foto,
todos.
bien.
Poxa,
Déjame poner aquí en una forma de presentación. Todos que pueden abrir sus cámaras. Un, dos, tres. Y otra, un, dos, tres. Muy bien. Muchas gracias por la presentación de todos. Nos vemos en un
el
mes.
próximo mes.
Chao, chao.
Un placer enorme. Gracias, Fabiola.
Ciao.
Muchas gracias.